viewers, this is Dr. Varun again. In this video, we are going to clear few misconceptions about PCOS. PCOS and Polycystic Ovary Syndrome is a very common condition. Often, patients tend to confuse polycystic ovary appearance on ultrasound with Polycystic Ovary Syndrome. Just appearance of polycystic ovary on ultrasound does not mean that you are having any disease or something like that. It can be a normal finding in adolescent women, or if it is not done at proper timing of the menstrual cycle. PCOS in fact is diagnosed based more on clinical symptoms than on the ultrasound findings. The clinical symptoms of polycystic ovary syndrome include irregular cycles and manifestations of increased androgens, that is testosterone and other androgens like scalp hair loss or unwanted hair growth, along with other findings like increased androgen levels in the blood or ultrasound findings of polycystic ovaries. And it's not necessary that all the women will have these findings or symptoms of irregular cycles and manifestations of increased androgens like hirsutism or scalp hair loss or acne. The symptoms can be varied, that's why the diagnosis becomes a little complex. So the next myth is that many patients think that polycystic ovary syndrome is exclusively because of poor lifestyle or obesity. It's not the case. The polycystic ovary syndrome can be because of it can be secondary manifestation to variety of hormonal reasons like thyroid hormone abnormalities or excess of prolactin or other conditions like cortisol and growth hormone abnormalities. So it's important that we look for these symptoms when we are assessing the patients with PCOS, and we have to rule out the other causes of PCOS before just labeling the patient as PCOS without any secondary causes of polycystic ovary syndrome. Next myth is that polycystic ovary syndrome is just an issue with reproductive organs. It's not the case. Most of the women with PCOS tend to have insulin resistance. So having symptoms of PCOS is the first warning sign that in future you are going to develop diabetes or cardiac disease or hypertension. So it's important that the lifestyle changes that you are going to incorporate for the improvement of polycystic ovary syndrome, these has to continue lifelong. The next myth is that many women think that those with PCOS cannot become fertile. It's an absolute myth. There is no science behind that. So PCOS women can have difficulty in terms of fertility because of irregular cycles, and as the ovulation window is basically like not so clear for them. However, their fertility can be normal. Some of them may require some medical assistance, but their fertility rates are normal. The next myth is that a lot of people, often frustrated by failed efforts for the weight loss, they tend to think that there is no cure or treatment for the PCOS. It's not the case. There are many secondary causes of polycystic ovary which can be, the symptoms of polycystic ovary syndrome completely become normal once the secondary causes are cured, which I have alluded previously as the secondary causes of polycystic ovary syndrome. Apart from that, those who are having polycystic ovary, they tend to benefit immensely from be it hormonal contraceptive pills or be it anti-androgen pills. They tend to relieve the symptoms significantly for women with PCOS. One more myth I would like to clarify is that a lot of people think that PCOS can happen only in obese women. Lean PCOS constitutes around 20 to 30% of the overall patients with PCOS, and these patients tend to have more of genetic causes, and even the lean PCOS persons tend to have some degree of insulin resistance, and although they are lean, their future risk of metabolic diseases is significantly increased. It's important that even those who are having lean PCOS, they should go on for these similar lifestyle modifications even though they are lean.